Welcome to the Sedation Narrator tutorial. You are required to use this for all patients undergoing a conscious, moderate, or procedural sedation. You will be able to find the Sedation Narrator under Narrators along the top bar. Once you are in the Sedation Narrator, go into the Staff section and add all staff present for sedation. Under the Pre-Procedure Documentation, select Sedation Start and enter the time of the start of the procedure. Hit Accept. Click into the Pre-Procedure Documentation section and complete Pre-Procedure and the Procedural Timeout sections. In the Procedural Timeout section, start under Procedure Name, select the type of procedure, for example cardioversion or orthopedic injury treatment for a reduction. Continue to fill in the information. Enter everyone that is present for the sedation, nurses, doctors, PAs, etc. Click Yes Timeout Performed to open the checklist to be completed during the timeout. The expectation is that each item is being reviewed with the team during the timeout. Check off the appropriate boxes as you complete each one. Hit Accept once done. Under Pre-Procedure, go through each item and enter information. These should be completed prior to the start of the procedure. The informed consent is completed by the provider. It is your responsibility to ensure the consent form is completed, signed, and lists the correct procedure before the patient is sedated. All of the emergency equipment should be inside or immediately outside the room prior to the start of the sedation. Throughout the entire procedure, you're going to use the Already score, so it is important to have a pre-procedure Already score to establish a baseline. Then continue to document the pre-procedure assessment in the fields below. If cardioverting a patient, be sure to add the current rhythm the patient is in. Once the timeout is complete and the procedure is ready to start, click into Intra-Procedure Documentation. Enter vital signs, including a baseline temperature, level of consciousness, and Already score. For policy, you will need to include N Title CO2, which you can add in the top quick bar. Under Oxygen Therapy, select the appropriate oxygen device and liters of O2. For sedation medications, enter the dose, person administering the med, and the time of the medications administered. It is very important to note, entering the meds in the narrator does not cross into the MAR. You will have to scan meds into the MARs separately. As a reminder, nurses are not allowed to administer intravenous push propofol. Hit Accept once complete. Per policy, you are responsible for documenting and assessing the patient's physiologic status, including heart rate, respiratory rate, blood pressure, pulse oximetry, EtCO2, and level of consciousness and adequacy of sedation Q5 minutes. Continue to document in the intra-procedure section. You can add additional medications if given another dose is needed. Remember to document the end Title CO2 in the quick bar at the top. Once the procedure is over, move to the Post-Procedure Documentation section. Continue Q5 minute Already and vital signs until the patient is back to baseline. Complete the post-sedation care section and essential documentation to ensure the patient has a safe discharge plan, if not being admitted. Per policy, for those patients who have received a reversal agent, a minimum of 2 hours of monitoring is required to ensure that resedation does not occur. Document your post-procedure assessment. For a cardioversion, remember to document the patient's cardiac rhythm post-procedure. Once the patient is back to baseline and no longer needs an assessment, document a final set of vital signs. Then go to sedation end and enter time and date of completion. Remember to scan the patient and medications from the procedure into the MAR. Refer to the policy sedation for diagnostic or therapeutic procedures for any questions. Hope you found this helpful. Thank you.